So many patients ask, what prosthesis do we use and why do we choose that prosthesis? There are a lot of different manufacturers out there and there's a lot of different materials. So what I'd like to focus on is the materials more so than the manufacturers, because I think most manufacturers make very similar products. The basis of the hip replacement decision-making tree for us is we prefer to use press-fit implants whenever we can. That being said, if the bone quality of the patient is not sufficient, for example, if you have osteoporosis or osteopenia and we're worried that your femur is weak, rather than run the risk of fracturing your femur while we're hammering in a press-fit implant into the femur, we'll actually fill up the tube of bone in the femur with cement and push a cemented stem into that femur to reduce the risk of femur fracture. In general, most cups into the socket on the pelvis, so the acetabular component that goes up into the pelvis, those still will be press fit most of the time. 99 times out of 100 we'll end up with a press fit there. In terms of the materials that we actually use, so on the press fit hips, it's a titanium cup and a titanium stem, and it has a coating on it that grows into the bone. After it fits into the bone tightly, the bone will actually grow onto that implant after 6 to 8 weeks and become part of the skeleton. The bearing surface is really what has some variability amongst surgeons around the world, and some things have changed over the last few decades. When you look at the rate limiting step of how these hips wear out, it's really the ball that articulates with the plastic liner. So the ball that rubs on the liner that goes inside that titanium shell is the tire on the car. It's the rate limiting step. It's the part that's going to wear out over years and years and years of living a normal, active, healthy lifestyle. There are various bearing surface choices. In the older days, we had plain old plastic, so polyethylene plastic with metal heads, and they would wear out in 10 or 15 years on average. Now we have some newer plastics that are called cross-linked polyethylene. Effectively, the very smart engineers that we work with have figured out different ways to prepare the polyethylene to make it more durable. There's various techniques. Some companies expose it to ionizing radiation during the manufacturing process. Other companies will actually remelt it at a different temperature so that it increase the number of covalent bonds that occur in the plastic to make it more durable and more resistant to wear and tear. Cross-linked polyethylene has been a huge benefit for us and our patients, and something that's really changed the face of what we do over the last few decades. And so with the addition of cross-linked polyethylene and ceramic heads, the wear rates look extremely low. There are some hard-on-hard options. And what do I mean by hard-on-hard? There's ceramic heads that will actually sit and rub on a ceramic liner. So you can put a ceramic liner inside the titanium shell. The ceramic ball rubs up against the ceramic. So that's one example of hard-on-hard. Another example of hard-on-hard is a metal head sitting in a metal liner. Now, we got burned back in sort of the mid-2005 to 2008 time frame. There were a lot of companies coming out with metal-on-metal implants. Why did people push metal-on-metal or hard-on-hard bearing surfaces? Well, the reason is we thought we had the Holy Grail. When you look at the wear characteristics or the wear rates of metal-on-metal or ceramic-on-ceramic, the wear rates are often 1/10 or less than a plastic bearing surface because they're harder, they're more durable, and the characteristics of the material just allow these things to last incredibly long times. Now, that's when you test it in the lab. We have hip simulators that we use and knee simulators where we can cycle through these materials millions of times and calculate how many cycles equals 1 year of human life and measure the microscopic wear that comes off these surfaces. And what we thought initially was that metal would outlast all plastic bearing surfaces, hands down. This is a hip replacement that we could put in someone and it would last their entire lifetime. Unfortunately, in the body, so in vivo, in the body, when you implanted the metal into the body, it had, in many instances, some unfavorable side effects and reactions with the tissue. So I know at one point we discussed the rate limiting step being the plastic. So the day you start stepping on that plastic bearing, whether it's a metal head, a ceramic head, or otherwise, you're generating microscopic wear particles into the joint fluid. They build up over years and years and years, and eventually they may trigger your own immune system to initiate a osteolysis. It's basically a immune modulated your body trying to protect these foreign materials that are in your hip joint. And so they will start attacking those particles, and it can sometimes adversely affect the bone metal interface. It'll actually start melting away the bone. Osteolysis literally meaning melting of bone, if you will, for translation. So when you looked at the metal, if the metal particles were much fewer, so let's say the plastic hip, you had 2 billion particles after a year, and the metal hip was 1/10 of that, you automatically assume that, oh great, the metal on metal hip will last 10 times longer. The problem is those metal particles in the body tend to be more immunogenic. So what they do is they poke the bear, if you will, a little faster. And we're seeing all kinds of issues with metal on metal bearings. I unfortunately had put in a lot of metal on metal for a period of time in my career, and I ended up pulling out 80% of them. The metal ions are bad locally for the soft tissue. Sometimes they cause just pain and swelling. Other times it'll cause abnormal tissue collections, fluid collections, lymphocyte aggregations, things that affect the tissue and the hip joint locally. We've also seen case reports and all of these things on the news and in the literature with all these lawsuits from these companies being recalled and all these implants being pulled. I've seen cases where I've been sort of an expert to review these cases where people have had systemic effects of things affecting their kidney. Even one case where the patient was unfortunate enough to have metal deposits in his myocardium and the muscle in his heart and needed a heart transplant. So there are all kinds of potential adverse effects. So the take-home message there is, even though it seemed like the metal on metal or hard on hards were a bearing surface that were going to last forever and maybe you only needed one hip replacement, the safety profile and the potential physiologic risks for you as a host, as a patient, are far too great in my opinion. And so we stick to cross-linked plastic now, or cross-linked polyethylene with the ceramic ball. Most of the data and literature suggests that this will last 25, 30 years or more. It's been used for decades. It's incredibly safe. There are none of these physiologic issues that we saw with metal on metal. And so that's why we choose the implants that we do with respect to hip replacement.